Now on deck are 250, 251, and 174.
Good evening.
Me first. Good evening, Commissioners and Mayor. My name is Maria. I live in North Portland and I teach in the Portland Public Schools. I'm here with the Mental Health Not Policing Community Coalition.
I'm Olivia, and I'm here with the Mental Health Care Not Policing Coalition.
Hi, I'm Zach Chavez with the Mental Health Care Not Policing Community Coalition.
Hello, my name is Chris-Ann Doherty. I live in Northeast Portland, and I'm a part of the Mental Health Care Not Policing community. I'm a retired public school teacher. I've seen the ways in which Portland police have been harmful in treating the mentally ill in crises. The experiences involved 2 of my family members.
Police will never be adequate or appropriate mental health responders, no matter how many hours of training they undergo. They are trained to neutralize threats, not care for mental health. Instances of use of excessive force, harm, traumatization and re-traumatization, and murder of those experiencing mental health crises in Portland have not shown substantial reduction even with training.
Police don't always equal safety. Police don't equal safety. And
Even in situations where someone experiencing a mental health crisis can potentially harm themselves or others, a police response often escalates the crisis and causes more harm. It is far more appropriate for someone who specializes in mental health and de-escalation to respond. Crisis response must shift to not engage police, and the budget must reflect this shift.
We demand a reduction in the police budget, not the proposed increase of $2.1 million.
Totaling the budget at $209.1 million.
Community and neighborhood safety cannot be achieved with increased policing.
Meanwhile, offices like the Office of Equity and Human Rights are requesting funding totals at a little under $2.5 million. And the Office of Neighborhood Involvement, whose goals include increasing community and neighborhood impact on public decisions and to provide tools and resources to improve neighborhood and community livability and safety, requests a budget totaling just under $10.5 million. Any funding for so-called community policing, neighborhood safety, citizen partnership, cycle of violence, or mental health must be redirected from the police budget into mental health and community projects that are not housed under the Portland Police Bureau.
I'm here to demand no money for policing of the mentally ill.
This funding must be invested in community programs such as increased and affordable housing, transformative justice models, and education.
we've got programs such as the Morpheus Youth Project. There's the REAL Project, which stands for Reject Economic Ableist Limits. There's creating an Office of Landlord and Tenant Affairs.
We reject the notion that the Portland Police Bureau needs more police and demand a reduction in officers. We demand that the City Council invest in life-affirming response to mental health crises by building up real community-based and peer-led services and resources.
I want to see more or some or any mental health care first responders, housing for the mentally ill, and community-run treatment centers.
By diverting funds away from policing, the city can invest in community-based resources and alternatives that specialize in mental health, build up people's capacity to know their options when dealing with crisis, and strengthen our ability to rely on each other. Thank you.
Thank you.
Thank you very much for listening.
Thank you so much.
Thank you.